Welcome back, everyone, at 9:15. So you've seen the pictures of those lip injections gone wrong. Well, now there is a new FDA-approved product that's being used by just 65 clinics in the United States. And Dr. Sherry Ingraham with Advanced Dermatology is here to show us how it all works. Welcome. Thanks for being here.
Thank you.
First question is going to be, what is this and is it safe?
It is safe. This is actually the newest FDA-approved injectable filler that's specifically approved for subtle correction of the lips, volumization of the lips, and the fine lines around the lips. And the reason this product is so unique is, unlike some of the other hyaluronic acids, it's made of smaller particles that are smoother. So it gives a silky, subtle improvement, hence the name Silk.
Okay. All right. So you are actually going to inject this
I'm actually going to inject Jody. And Jody actually had this injection about a week ago. So you didn't see Jody's before picture, but we've given her some subtle volume in her lips. And of course, we want the lips to look natural. And so there's a technique that we specifically use to maintain that natural look.
So this is the before picture that we're looking at just before you go ahead and inject her lips. And you mentioned also that it's a correction, right?
Right.
Is this to correct a problem, or is it just cosmetic as in I want fuller lips?
You can correct a problem, but most patients are coming in because they want subtle enhancement. As we age, this naturally occurring hyaluronic acid that is in our bodies goes away, and we lose some of the volume in our lips, and we also lose some of our natural underlying bony and muscular support structures, and so our mouths become a little bit involuted in some patients. The lips will turn in. So we want to actually evert the lip. We want to get that nice eversion, as well as sometimes define what we call the white roll, which is this nice reflective tissue you see along the edge of the lip. And so we do that with a series of really nice, slow and superficial injections. And so again, Jody had this treatment about a week ago. So I'm just touching up an area that needs a little bit more volumization. And as you can see, she's tolerating this very well.
And when you're touching up, doctor, I want to mention that you're squeezing the lip as well with that left hand.
Very subtly. You know, with this product in particular, you don't want to massage this product a lot. It's such a superficially placed product and such a light product that it actually doesn't need a lot of manipulation or smoothing after it's injected, unlike some of the bigger particled hyaluronic acids. You can also put this product above the lip and fan it out in this upper cutaneous lip area. So for patients who have smoker's lines, fine lines around the lip, even due to sun damage, it does beautifully when we put a thin sheet in the upper cutaneous lip area.
What is the cost for something like that?
You know, the cost, because this product is really, you want to hold that there, Jody, for a moment? Because this product is just now coming out on the market, we're really only going to have it available next week in our clinics, a small group of 65 physicians in the country. There's about 5 physicians in Texas that'll have it next week, including our practice. You're probably looking at something in the $500 to $650 range per syringe, I would imagine, you know, which is comparable to what Restylane is now. But again, it's up to the provider how they're going to charge. The nice thing also about this product is it takes such a small amount. Truly, one syringe will treat to the correction you're looking for in the lips. So you want to show Jody's lips? I mean, you can see, and you didn't see her before, but what we've given Jody is a beautiful Cupid's bow with this product, a nice fuller lower lip, and those are two things in an aging lip that tend to go first.
All right, so there's the before, and then of course we're looking at the after, which is right now. And Jody, you know, you certainly took it like a champ. I was cringing for you over here just because of the looks from that needle, but just tell me what it felt like.
It feels like a little stick of the needle. You don't really feel a whole lot of pressure, and there's just a slight burn, but it's not anything like the old products. It's very, it feels good. I mean, it doesn't feel good, but it doesn't hurt.
So when you see the after and you look at yourself in the mirror, do you feel different, or?
I do. It feels like you kind of put that volume back in that was there maybe 10, 15 years ago.
Would you recommend it for other patients?
Absolutely.
What if they're scared of needles?
We numb the lips, and we've got lots of techniques to do that to keep it very comfortable for the patient. So I would recommend it to anybody, even someone who is scared of injection.
And Dr. Ingraham, of course, you're so calm and very gentle with her, as we just saw. So thank you all so much for being here.
Thank you.
Awesome. We'll leave you with one last look at the before and after.
Now you can really see her upper lip, I think, needed some volumization. I think that's where on Jody you can see the most improvement. And Jody's had other fillers in her lips before, and I think we were talking about this product, this new Restylane Silk, is so much softer and more natural. You don't feel that bulk and that swelling with this product, and it doesn't have that rigidity, so it just feels more natural and smooth, which is nice.
We'll be right back.